Hi guys, welcome to the Dollar Care Organization, which is a non-profit organization including Catholic Health System, Providence, Kaiser Hospitals, receiving property tax exemptions because they provide essential services that benefits the public, such as healthcare, education, and charitable programs. In return, these exemptions are expected to fulfill specific obligations that justify their tax-free status. How they contribute in exchange for tax exemptions? How? Let me explain to you. Providing charitable healthcare services. Non-profits, hospitals must offer community benefits, including free and subsidized care for low-income patients, health education programs, and outreach initiatives. You evaluate, yes, how much they serve. Kaiser Permanente, which is a nonprofit, reports billions in community health investments annually, including free clinics and preventive care. Yes. Number 2, relieving government burdens. I want you to evaluate how much they are relieving this nonprofit by serving uninsured or underinsured populations. These hospitals reduce strain on public health care system indirectly, saving taxpayer money. Some states like Massachusetts explicitly require nonprofits to demonstrate they relieve the government of some burden to qualify exemptions. I don't understand why they don't participate in health savings and encourage providers to have health savings accounts. Payments, number 3, payments in lieu of taxes. While not legally required, some nonprofits voluntarily negotiate pilots with the local governments to offset lost tax revenue. For example, Boston has a pilot agreements with major hospitals like Brigham and women's affiliated Harvard. These payments fund infrastructure, schools, and emergency services. Yes. 4, compliance with state-specific requirements like California, Massachusetts mandate that tax-exempt properties be used exclusively for charitable purposes. For example, no profit generating ventures unrelated to their mission. Non-profits must file annual reports proving their activities align with tax-exempt goals. And number 5, economic and social contributions. Non-profit hospitals employ thousands, stimulate local economies, and often anchor underserved communities. They also invest in research and training programs, example like medical residencies that benefit public health. Controversies and challenges. Folks, this is where we need to scrutiny over charitable care. Some argue nonprofits don't provide enough free care to justify their exemptions. States like Pennsylvania have sued hospitals for insufficient charitable care. If they are providing insurance, Kaiser acts like an insurance company. Why don't they encourage to have high deductible health plans with empowering Americans in contributions towards the HSA? I don't understand why Kaiser doesn't encourage people to have HSA accounts. Local pushback. Cities facing budget shortfalls increasingly pressure nonprofits for pilots, even without legal authority. Key takeaways, folks: tax exemptions are not free. They are trade for services that government would otherwise need to fund. Nonprofits must continually prove their public benefit to retain exemptions, whether through direct care, pilots, or community investments. For specifics on hospital contributions, check its IRS Form 990. Folks, you guys need to check it out. Publicly available for all of you to evaluate their contributions. State Health Department reports are available in the IRS 990 form. Would you like to help including such data for a particular institution? Folks, being a founder for Dollar Care organization, I want Americans to be empowered. Not these hospitals, providers, insurance companies. Americans need to be empowered. Why can't nonprofits encourage high deductible health plans, lower the insurance for families, and having health savings accounts for all Americans? Why didn't they do that? Why doesn't Kaiser encourage people to have HSA contributions, which is better than IRA? With triple tax exemption, folks, contributions are tax-free. Whatever the contribution, a single person is $10 a day, married, $20 a day, are tax-free contributions, folks. And the money in the health savings, which is in the bank, can be transferred to the index funds, which appreciates 12-15% every year. And that's tax-free too. Appreciation is tax-free. And payments, when you go to the doctor, when you go to the hospital, don't give your insurance card. Make sure before you give your insurance card, how much is this for this service? They cannot bill the insurance without your signature. Do not sign the initial form, but that's not the bill. They have to send you the bill, then you approve it, then they send it to the insurance companies. Folks, this has got to be done. Thank you for listening, Dollar Care. If you like what I'm saying, subscribe, share, and make some comments, folks. I love to hear from you. And I want to see healthcare costs go down. It's not $3.8 trillion towards healthcare is too much. We can lower it by half if it's done right. Again, you know who is the best person to lower the costs? You! Not insurance companies, not providers, not hospitals. Come on. Americans are good at lowering the cost. Look at Amazon, look at Google, look at Microsoft. These are all because of you guys, consumers. It has to be consumer-empowered healthcare. Thank you for listening. Goodbye and God bless.